Hi, welcome back. This module, Module 3A, is going to be talking about addiction, what addiction is. So the learning objectives for this component of the training are that you will understand the terms addiction and the DSM criteria for substance use. That is the Diagnostic and Statistical Manual of the American Psychiatric Association. You will understand different substances and their classifications. And then you'll understand what addiction is and how it alters the reward pathways of the brain. So the ASAM definition of addiction is that it's a primary chronic disease of the brain that affects reward, motivation, memory, and related circuitry. And the dysfunction in these circuits leads to characteristics that are biological, psychological, social, and even to some extent, spiritual. So when you look at this slide, you have to begin to appreciate the fact that addiction affects individuals in many different areas. It affects them in terms of how they are psychologically, it affects them in terms of where they are biologically, it affects them in terms of their sociability, and even affects them in terms of their own spirituality, or to put it another way, how they view not only themselves, but how they view others. So when you think about additional characteristics of someone who is addicted to a drug, you think about their inability to consistently abstain, in the sense they lose control over their ability to make good choices about the drug use. They crave the drug. In other words, there are times when they're not using the drug that they wish they were. There's a psychological preoccupation with the drug where they're thinking about use and the pleasures that are associated. And to some extent, there is a dysfunctional emotional response. So rather than looking at the drug in a healthy way, they begin to look at the drug in a disordered way. And that process is incremental. So the Diagnostic and Statistical Manual is the manual that we use to diagnose disorders. Not only these disorders or addiction disorders, but also the disorders that we talked about earlier around behavioral health. So when you think about substance use, you think about the number of the criteria that are listed in the DSM, and there are 11, how many of these criteria the client meets. And based on the number of criteria that they meet, you're able to assess a severity specifier. And the severity specifiers are mild, moderate, and severe. So if the client meets 2 out of 3, they're considered to be mild. If they meet 4 out of 5 of the criteria in the DSM, they're considered to be moderate. And if they meet 6 to 7, the diagnosis, the severity specifier, would be severe. This slide talks about the criteria that come from the DSM. And if you read down, you'll see that there are about 11. Taking the drug in larger amounts, wanting to cut down but not being able to, spending a lot of time obtaining the drug, craving, and so forth. So these are the criteria that the DSM uses to assign whether or not that client has a substance use disorder. And again, as I said a few minutes ago, you need at least 2 to warrant a mild severity specifier. This slide talks about commonly used substances and their classifications. So again, drugs are listed by schedules based on whether or not they have any medicinal value, whether they're used by physicians, whether they're used recreationally. So this gives you an understanding of that classification and schedule system, so that when a client tells you they're using a certain drug, it gives you an indication of whether that drug can be used for purposes, medical purposes, or whether it's just used for recreational purposes. So this is a great chart that gives you the schedule, and you'll be getting this in a PDF format for your own use. So not only do drugs have a psychological component to them or an emotional component, they also have a physiological component to them. So addiction actually triggers certain reward pathways in the brain, neurologically. And when an individual gets involved with a drug, not only do they give up their psychological and emotional choices around use of that drug, but there's also a strong physiological component. So it helps us, this slide helps us understand why it's not easy to just make a choice about whether or not you want to use a drug. It's really not a choice when it gets to this point. There is a physiological hook that denies the person the ability to be able to make choices about the drugs that they use. This slide talks about other issues or behaviors that a client can become addicted to. Disordered gambling is one that is in the DSM-5. For the first time now, we have gambling as an addiction. It's first time. Kleptomania is in the DSM. Compulsive buying is not, but we certainly know people who get habituated to compulsive buying. Skin picking or skin excoriation disorder is in the DSM. Sexual addiction is not. But again, there are people who become habituated to sex, who use sex for purposes other than healthy purposes. Excessive tanning, people who have potentially maybe a body dysmorphic disorder, compulsive video gaming, and internet addiction. And I can tell you that my sense of these, in terms of, if you would ask me what I think is going to be coming next as a regular addiction in the DSM, I would say it's internet or the internet gaming. I think that probably is the one that's going to be coming up next, is an inclusion in the next edition of the DSM. This slide talks about risk and protective factors. If you look on the left-hand column, you see that aggressive behavior in childhood, lack of parental supervision, poor social skills, drug experimentation, availability, and poverty are risk factors for addiction. And then protective factors would be good self-control, internal locus of control that's good, parental monitoring and support, positive relationships, academic competence, doing well in school, anti-drug policies that schools utilize, and finally, a good sense of community, a good sense of being in a neighborhood, in a community, are all protective factors. And again, hopefully what you've learned here is that what does addiction look like? What are the criteria as based in the DSM? The classifications of drugs, and how addiction alters the reward pathways in the brain, which renders a situation where it's not just a free choice.